Hello, everyone. So today we will be talking about oral cancer. My name is Pamela, and my classmates' names are Alexis and Will. So today we'll be talking about oral cancer. What is oral cancer? Cancer. Oral cancer includes cancers of the mouth and the back of the throat. Oral cancers develop on the tongue, the tissues lining the mouth and gums, under the tongue, at the base of the tongue, and the area of the throat at the back of the mouth. So the common sites for oral cancer include inside under the lips, can be on the lips, on the side of the tongue, again, a little bit more so on the tongue, side of the tongue, under the lip on the bottom, inside the lip, back of the throat, under the tongue, and back of the throat.
Some statistics about oral cancer. Approximately 54,000 Americans will be diagnosed with oral or oropharyngeal cancer this year. Oral or oropharyngeal cancer will be responsible for over 9,750 deaths, killing roughly one person per hour, 24 hours per day. Approximately 57% of those 54,000 newly diagnosed individuals will be alive in 5 years.
Causes: tobacco and alcohol use. Tobacco use of any kind, including cigarette smoking, puts you at risk for developing oral cancers. Heavy alcohol use also increases the risk. Using both tobacco and alcohol increases the risk even further. HPV. Infection with sexually transmitted human papillomavirus, specifically HPV 16, has been linked to oral cancers. Age. Risk increases with age. Oral cancers most often occur in people over the age of 40. And sun exposure. Cancer of the lip can be caused by sun exposure.
Symptoms: a sore irritation, lump, or thick patch in mouth, lip, or throat, a white or red patch in mouth, a sore throat or a feeling that something is caught in throat, difficulty chewing, swallowing, or speaking, difficulty moving jaw or tongue, swelling jaw that causes dentures to fit poorly or become uncomfortable, numbness in tongue or other areas of the mouth, ear pain. If these symptoms are present for more than 2 weeks, see a dentist or a doctor.
Diagnosis. Early detection is important because oral cancer can spread quickly. The death rate associated with oral cancers is particularly high, not because it is hard to discover or diagnose, but due to the cancer being routinely discovered late in its development. An oral cancer examination can detect early signs of cancer. The exam is painless and only takes a few minutes. Many dentists will perform the test during your regular dental checkup. During the exam, your dentist or dental hygienist will check your face, neck, lips, and entire mouth for possible signs of cancer.
These are the 8 steps of oral cancer screening. You're going to want to begin by lifting up the upper lip and checking the gingiva and the mucosa. You're going to want to use your thumb and your index finger in a pinching fashion and palpate between the lip on the inside and outside of the lip. You're going to want to feel for lumps and bumps, anything that may feel abnormal. You're also going to want to check your cheeks on the inside of your mouth, what's referred to your buccal mucosa, and against the side of your posterior gingiva as well. After that, you're going to want to pull out your lower lip, just like you did your upper lip, and check your vestibule, which is where the attached gingiva meets the mucosa, and the anterior gingiva as well. After that, you're going to want to tilt your head backwards, looking in the mirror, and examine your hard palate on the roof of your mouth. It also, as an assist, you can use either a tongue depressor or the back of a spoon or even your finger to hold down your tongue and to examine the back of your throat and the tonsillar area and the soft palate. After this, you can raise your tongue to the roof of your mouth to check the floor of your mouth, which is also including the ventral surface of the tongue, the underneath area. And finally, if it helps, because your tongue may be a little slippery, try wrapping your tongue with a little piece of cloth or gauze, and you can use that to more or less lasso your tongue and move it left and right to look at the lateral side borders of the tongue.
During your screening, your dentist may use Velscope. So Velscope does not diagnose cancer. The device emits a blue light to help show abnormalities inside your mouth. So here is an example of tissue under normal light, and then using the Velscope, it shows the full extent of abnormality, and it shows a kind of dark area in the hard palate or on the hard palate. Same here. This seems like the side of the tongue. You can kind of see a dark area using the Velscope again. And then again here, they kind of highlighted it in the tongue where it seems to be red and kind of patchy. And then again, you can see here on the right side, brown, dark colored area.
Self-examination is easy and could save your life. Some common symptoms include ulcers, which do not heal within 3 weeks, patches, red and white patches in your mouth, any unusual lumps or swelling in your mouth. Some statistics, 4 in 5 people do not know the symptoms. That's why it's important to have your dentist check your mouth as well as doing a self-examination at home. And like it says, approximately 53,000 new cases occurred in 2019 in the United States.
So what does oral cancer look like? These patches can be a problem. Here's an example of a small white lesion, a white patch on the upper mucosa over, I would say, pretty much between your canine and your first premolar. Something like this may go unnoticed and it may not be painful at first, but during self-examination or examination done by your dental professional, it may become apparent. So make sure we try to get these examined fairly routinely and to do them yourself at home in the mirror.
And here we also have another picture. This is more of a white patch on the side of the tongue. So these will be, you can probably notice it yourself, but also when you get your annual dental checkup or at your every 6-month checkup with your dentist, they will do an oral cancer screening and they will check for these type of white patches.
Here's another patch that looks like it may be a problem. Normally, any mixtures of red and white patches signal a problem, as well as bright red patches and anything that may look and feel velvety or grayish in color.
And finally, here's one more example of an idea of what oral cancer can look like. This is on the posterior of the ventral tongue. As you can see, something like this, despite its appearance, may not actually be painful at first. So it gives you an idea of what to be looking at, but also, word of warning, caution that, stuff like this can go unnoticed if you're not performing routine oral screenings yourself or having them done by a dental professional.
So types of oral cancer. So squamous cell carcinoma. More than 90% of cancers that occur in the oral cavity are squamous cell carcinomas. Normally, the throat and mouth are lined with what is called squamous cells, which are flat and look like fish scales through a microscope. Squamous cell carcinoma develops when some squamous cells mutate and become abnormal. Verrucous carcinoma accounts for about 5% of all oral cavity tumors are, again, verrucous carcinoma, a type of very slow growing cancer made up of squamous cells. This type of oral cancer rarely spreads to other parts of the body, but it may even invade nearby tissues.
And two other types of oral cancer, minor salivary gland carcinomas. They are usually found throughout the lining of the mouth and the throat. And there's an example. And last, lymphoma. It can include the tonsils and also the base of the tongue.
Finally, treatment. When oral cancer is detected early, it is treated with surgery or radiation therapy. Oral cancer that is further along when it is diagnosed may use a combination of treatments, which may include radiation therapy and chemotherapy, which are often given at the same time, or targeted therapy, which uses drugs or other substances to precisely identify and attack cancer cells.
And that completes our presentation. Thank you so much for watching. Anything you guys want to add?
That's it. Thank you so much for your time.
Thank you.